So special case, he is having a condition called as osteoradionecrosis of the jaw. So it's also called as ORN. So this condition usually occurs in the jaw following radiotherapy. So several years back he had a history of a CA parotid, carcinoma of parotid. So he has underwent the excision of the parotid. That's why you can see a depression. If you come a slide closer, come closer. So you can see a depression of this area. So this is because the parotid has been removed, following which he has underwent a radiotherapy. You can see a scar there. So this is the scar of the previous surgery. You can see they have dissected the neck. So all these scars are from his previous surgery, and also the skin has become tight. That's because of radiotherapy. Now he is Amadi. Now he is having a condition. You can see he is not able to open his mouth completely, and there is a necrosis of the jaw there. So he has underwent extraction of a tooth following radiotherapy, which has resulted in a condition known as osteoradionecrosis of the jaw. So we have done a debridement, or the whatever debris was removed in the previous surgery. Now we are planning to do the resection because there is a complete necrosis of the jaw. We are planning to do a segmental resection of the jaw. If we don't witness any good bleeding or any good bone, we are planning to do a mandibulectomy and reconstruction of this area using free fibula flap. So all of these will be done in one surgery. We are planning to do a nasal intubation for this patient. So following the surgery, he will have a new jaw reconstructed using his right side fibula, and also we are planning to give an inner lining using the skin of the fibula. So this is both a hard tissue as well as a soft tissue reconstruction we are planning for this patient under general anesthesia. Now we will be shifting the patient to the operation theatre. Thank you. So this is the CT scan of this patient now. So you can see how the entire lesion has eaten up the bone. You can see that's the cavity, that is the loss of bone that has happened because of this osteoradionecrosis of the lower jaw. So that's the nerve canal, which is very close to this lesion. So we're going to take this part of the lesion, we're going to do the resection and then replace this bone using the free fibula bone from the leg of the same patient. So this will be done under general anesthesia. ನಿದ್ದೆ ಬಂತ ನೈಟು? ಓಕೆ. ನೋವು ತುಂಬ ಇತ್ತಾ? ನೋವೇನು ಜಾಸ್ತಿ ಇರಲಿಲ್ಲ. ಕಾಲ ಹತ್ರ ಸ್ವಲ್ಪ ನೋವು, ಇಲ್ಲೇನು ಜಾಸ್ತಿ ನೋವಿಲ್ಲ. ಓಕೆ, ಆಲ್ ರೈಟ್. So today is first day following the surgery. So we have done a fibula reconstruction of the lower jaw. Segmental mandibulectomy has been done, and we have harvested the vascular flap from the right side of the lower limb. So today is just first day. So he's having a mild edema in the operated side. He's having slight a bit of pain in the harvested side in the leg, but he's having no pain in the jaw. And so we have placed him on Rales tube. So this feeding will be continued for another 1 week, and then we'll slowly convert to oral feeding. So as of now he's on antibiotics and painkillers. Now he's in the ICU. He'll be shifted to the wards. So we will follow him up, and we have given him instructions to keep the oral cavity clean because that's where we have grafted. So we will come up with the follow-up videos in future. Thank you. So this is 1 week later after a major jaw surgery for this patient. So you can see the scar is healing now. So he had a parotid tumor, as I told you before surgery. So we have done a reconstruction of the lower jaw using his bone from the leg. So we have used a free fibula flap. This part of the bone has been taken from his leg, and we have done the reconstruction in the jaw. So everything has been done to give him a contour. We have removed the disease and now the patient is absolutely fine. ನೋವಿದೆಯಾ ಇವಾಗ? ನೋವೇನಿಲ್ಲ. ಸೊ ಇವಾಗ ಊಟ ತಿಂಡಿ ಎಲ್ಲ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರಾ? ಗಂಜಿ ಎಲ್ಲ ಬಾಯಿಂದನೇ ತಗೊಳಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ದೀರಾ? So as you can hear, he's having his diet, everything from inside of his mouth, and there's no Rayleigh tube or anything. There's no tube that is passing from his nose, so he's having a normal diet, soft diet. So this is just 1 week after surgery. We will come up with the follow-up videos in future. So this is after surgery radiograph. You can see a big plate sitting over there. So this plate is extending from the chin area to the coronoid process of the mandible. So this length of the bone is taken from the lower limb or the leg of the patient. So this bone has been used for the reconstruction of the lower jaw. So the entire lesion has been taken out and then replaced with the bone that's called the fibula free flap or the graft bone. So this is just a week after fixation or reconstruction of the lower jaw, major jaw surgery.